Welcome back again, Favor Healthcare Institute from Minnesota, mock scale 2024. That was on update on August. We're going to do one of our skill that is positioning the resident in bed. So these skills, you have to understand what's the biological reason why we have, what's the reason behind why we have to be positioning our residents in bed. We have to know that for us doing that positioning, we are helping the resident from having bed sores, from having those skin breakdown. Think about lying on your back for almost 4 to 6 hours. What can happen to your skin? What is happening with your blood flowing on that skin tissue? So it's very important as a caregiver to know you have to position the residents if they cannot do it. So what will they test you when you go to the testing center? When you go to the testing center, they have to know, are you able to follow the instruction? This skill is all about clear instruction to follow. And the instruction will be position to the right, position to the left. They want to know, do you get the side of the patient you are positioning them? Are you understanding where you are positioning them to? Because if I give you instruction, position Jamie to the right, and you end up to position Jamie to the left, that means you did not follow the instruction. And because of that, it's the patient side. Don't look on your side that you are standing. If you look at where I'm standing right now, I may say, this is my right, this is my left, but if someone standing facing me will be saying, no, this is my right, this is my left. So you have to know, it's the patient side, not your side. And the side you are positioning them to, that means that is the side you are returning them to face. And in this skill also, you needed to remember to use teamwork. They want you to call an instructor as your partner or to stand on the other side of the bed when you're positioning it up. So let's start. What are our equipment we need? We only need 3 pillows because always there's 1 pillow in the resident room that makes it 4. But you have to know, you have to touch that head pillow for the skill to be complete with 4 skill, with 4 pillows. So we're gonna use now 4 pillows to position the patient. And then what is the instruction? We have to know what is the instruction we have been given. The instruction is position to the right. So as we start our first steps when we enter in, let's start by knocking. I'm sanitizing my hand. Come in. Good morning.
Good morning.
My name is Vane. I'm your caregiver today. I'm going to help you to position you or to turn you. Is that okay?
Yes.
So once I have that, I'm going to do my safety. Make sure my bed is locked. I'm going to make sure providing my privacy for my patient. So definitely you needed to make sure you just providing it. But because I want you guys to be able to see what I'm doing, I'm just demonstrating that. So I want to raise up the bed to my working level. So while you are doing this, because of student testing, you have anxiety, somebody's watching you, you might have forgotten the instructions. I tell students, take this chance to ask for clarification. Instructor, please, what side do you want me to turn the patient to? Then the instructor will give you, turn the patient to the right. So what do you do? If you have hard time knowing where's your right and where's your left side, stand and then make yourself in the same position with the patient. Then you start saying, this is my right, then this is the left. That means I'm supposed to turn the patient to this side, which is the right side. So what do? The side you are turning the patient to is the side you're gonna ask help for the instructor. Instructor, please, can you come and stand for me on the right side? Because you're gonna go on the back because you're the one who's doing the job. The instructor will stand this side and you're gonna move the other back. So I'm gonna move the other side. So while I'm on the other side of the bed, so this is what I have to look at. So this skill, I can, because I want to make sure I'm positioning them right, I can just go ahead and open them up. This is what you need to see. I'm just trying to take off the sheet so that everyone can see what I'm going exactly to do. Think about this. I'm turning my patient to that side. I have to make sure there's a space there. There's a room. Because I don't want when I'm turning my patient, their head end up hitting the side rails. Or maybe they are more at the edge of the bed and they're going to slide off the bed. And that's why it's very important to ask for teamwork, to have somebody to stand next to you. So what do? I squeeze them. I move them to my side. So we go with shoulder to shoulder, hip to hip, then we go to their legs. So we're going to move. So in a count of 1, 2, 3, Amy, I'm going to move it to my side. 1, 2, 3. Move them. And when you tell them, they help you to move. Come to the hip in a count of 1, 2, 3. In a count of 1, 2, 3. So whenever even I'm moving them, I have to check how is their body alignment. Is their body straight? You know, once they're this, then I can go ahead, I can move even because I want to make sure they are comfortable as much as I'm trying to do that. So Amy, can you hug yourself please for me? Why do I have to do this? Think about this shoulder. If I don't have them to hug, hand is lying down and they turn, they're gonna end up to break their shoulder. So I have to be very careful there. Have them hug themselves. I love to bend the knee. I love to do this. Some students, they prefer to do crisscross like that, but I love to do this. So if I have the instructor will be standing on that side for the safety of my patients. So what I'm going to do, I'm going to count in a count of 1, 2, 3, then we're going to turn. In a count of 1, 2, 3. So look at that, the space I built had that. So once I have that, I'll bring my first pillow and I will tuck it under the back. So you make sure you tuck it very well. And then once I've had that one, so because the instructor was just on the other side as part of my teamwork, it's gonna be my responsibility to move to this side. So what am I going to do this side? I'm going to move my patient head. I'm going to move your head. Make sure the head is just in the middle of the pillows. Then I'll bring my third pillow. Come here. Let's check out their leg. This leg has to be straight back because if the leg is straight back, it tells me their back is straight. And this is what we call body alignment. So I take off my pillow and I'll pull it under. Once I have this, I'll bring my last pillow. Now I'm gonna have it over here so they can have their arm to rest. And the other arm can have them to rest it over here. Look at how our patient is just, it looks so comfortable. I'm telling you, once you have them this, they are so comfortable in that position. So you don't want them to leave them uncovered. So what you do, cover them up. And remember, this is a dry skill. We are not using gloves in here. So this is a dry skill. Get them covered. Once they are covered, I'm going to lower the bed because we said never leave out of the patient room while the bed is in a higher position. So I'm going to lower the bed until the bed can no longer move down. Once I have that one down, checking myself locked, then I'm going to go ahead and move my privacy. Do your last step. Check yourself. What was the instruction? Turn to the right. Okay, my patient facing the right. I've done everything. So what next? My exit steps. I'm going to make sure I give my patient the call light. I'm trying to get out the little, I think I'll start somewhere here. So you make sure physically they are holding the call light. Here's your call light. In case you need anything, please let me know. Then I'll do my last step, sanitize my hand, and I'll tell the instructor that's the end of my skills.